Our last speaker, Dr. Alina Marin, is an assistant professor with the Department of Psychiatry at Queen's University. She works with adult inpatients at KGH and outpatients at Hotel Dieu Hospital, where she carries the adult ADHD clinic. Dr. Marin is here to round off our options for today and talk about the areas of research in mental health.
Good afternoon, ladies and gentlemen. Thank you very much for inviting me here today and for giving me the opportunity to talk about one of my dearest topics, translational research in mental health and psychiatry, and why it matters. I don't have any conflicts of interest in my talk today, so there are no disclosures to be made. Translational research has been made a priority across the countries and across the medical disciplines. It means an enterprise for harnessing knowledge from bench to bedside. It is an interface between basic sciences and clinical medicine, with an end goal to produce better treatment. And furthermore, translational research also means translating the knowledge acquired by research to daily practice to ensure that the knowledge we know and the new treatments we discover really reach the patient population. For psychiatry and mental health, more than for any medical discipline, translational research is important. Some time ago, it has been identified that the dichotomy between those practitioners who believe in biological causes and treatments of mental illnesses and those who rather believe in environmental causes and influences, this dichotomy is one of the most obstructive causes of the lack of progress in psychiatry. However, over the years, little progress has been made, and we still are at the level that in our clinical practice we see presentations which overlap in with regard to their symptoms, for which we kind of label diagnoses based on our best clinical guess, which is not really good enough to my opinion. We actually see conditions which overlap or which share emotional instability and to some extent deficits of behavioral control, problems with attention and with executive function, and interpersonal difficulties, without really understanding where the difference between the conditions is situated. With Darwin in 1872, emotions have been recognized as being critical for survival. Later on, they have been admitted to have an adaptive value in responding to the changing conditions of the environment. And recent biological research has identified emotions as biological processes meant to support appraisal of specific situations and prepare for actions according to internal goals and needs. The question is, how can we disentangle these events which happen in the brain? And basic biological research has shown that lower levels of the brain actually contribute through several areas, but mostly through a part in the brain called the amygdala, to activate reflex responses to the environment, while different processes like distraction and reappraisal allow higher levels of the brain to control responses, to control behavior according to previous experiences and to internal values. Furthermore, areas have been identified in the brain, some of which overlap, which are responsible for reprisal and for distraction, for our capacity actually to decide what our response would be, and not to allow reflex mechanisms to take over. Translational research in mental health is required in order to connect symptoms and behavior to specific areas of the brain and connections between these areas of the brain for better treatment and better outcomes in mental health. Eye movements have been found to be used or to be useful in designing research which probes the ability of subjects to generate or inhibit reflexive and voluntary responses. And a lot of work has been done at the Queen's Eye Movement Laboratory in this direction. Some research done on patients with ADHD link the eye movement and the characteristics of these processes with the well-known deficits in inhibition which are produced by patients or presented by patients with attention deficit hyperactivity disorder. Together with this lab, we have thought about a project, and we have piloted a project which was meant to try to find differences between patients with bipolar disorder and patients with ADHD in order to adjust the treatment to specific deficits. And I am just going to present you the research paradigm we used. The green dot in the center of a computer screen tells actually the subject that when a light will come on the screen, the subject is supposed to look towards the light. Or if the dot is red, the subject was previously instructed to look to the opposite direction from where the light has appeared. What we have further done, we have overlapped the dot with a face which expresses an emotion, so a facial expression of an emotion, or with an object which has a neutral emotional significance. So for instance, if the subject sees this image on the screen, the subject would look towards the light dot. And what do you think, what would the subject be requested to do if she sees this image on the screen? The subject would be requested to look in the opposite direction, and we measure reaction times and errors. And we were able to find in our small pilot study differences between patients with bipolar disorder and ADHD. And if we looked at the specific emotional expression of the facial picture, we have been able to identify that sad and neutral expression, emotional expression, can differentiate patients with bipolar disorder from those with ADHD and from normal controls. The implications of this research is that it helps us get a higher diagnosis accuracy based on physiological markers and helps us move along from guessing diagnosis. It can, in the future, improve research testing on if and how do treatment work, and would support our future research to find better outcomes. So in summary, the translational research in mental health and psychiatry is required to foster collaborative research partnerships. It is required to ensure that the findings are widely disseminated and really get to be used in our daily decision making, and to test and further on later to test the implementation of the evidence and how this can lead to better outcomes in mental health. Thank you, and I would appreciate your questions.